Welcome to Plastic Surgery Untold. I'm Dr. Johnny Franco, also known as Austin Plastic Surgeon, and I got our celebrity cast here for another exciting episode. Today it's going to be injectable treatments you've never heard of, but should have. This episode was actually created by one Gilberto Sainz, Austin's most beautiful man. So, Gilberto, thanks for joining us today.
Thank you, Dr. Franco. It's a pleasure as always.
You seem a little excited and anxious for your episode.
I am
as you guest produce occasionally. We also got the rest of our infamous crew here. One celebrity anesthesia.
What's up, you guys?
For those of you watching at home, yes, he does have a shirt on, so you can let your children watch. And then we got a rare appearance by one producer, Donald. As you could tell, we weren't able to find anybody else, so he stepped in. And it's a tough lineup to get on here with us, but somehow Donald found his way in. So
That's
boom,
right.
boom, here we are.
That's right.
Let's catch up before we get into Gilberto's episode here. Let's catch up with everybody and see what's going on. Donald is the new man on the show. What's been going on? It's been probably about 2 years since we had you on the show. Anything new and exciting in your life?
Yeah, man, it's been real busy. So I've been pretty busy speaking about diversity and equality in the video game space. So this month alone, I got 4 talks that I'm giving. I just finished up a talk at UT, University of Texas, Hook'em. And yeah.
Oh, I thought here in Austin you were talking about UT, University of Tennessee. I'm glad you clarified. I was confused there for a minute, but for all of our worldwide listeners,
Exactly.
they appreciate that. Okay, good.
Exactly.
Thank you.
But yeah, no, that's been the busy part of my my last couple of months. So that's what I've been up to, man. It's fun.
And it's kind of nice because I know you had a big part at South by Southwest, and then that stuff got canceled. But seems like maybe you're kind of supplementing that with some. Not exactly the same stuff you were going to do, but kind of in a more empowering way now.
Yeah, actually, as a matter of fact, I had about 5 talks lined up at South by, and then so I've been able to piece together some of that, throughout the year, and then at the end of September, I should be in Helsinki, but unfortunately, good old coronavirus is preventing that, so I'll have to do the talk via Zoom. So.
Just kind of interesting that Donald had 5 talks and he's in close enough with them that he calls it the South by, and yet none of us got platinum wristbands from him.
Yeah,
so, it's interesting. That's all I'm gonna say. It's gonna be interesting when Botox comes around. Be like, sorry, Corona.
Oh, okay. I see how it is.
Celebrity, what's going on with you? I feel like you haven't traveled the world lately. I feel like I've been traveling more than you have, and that makes it feel awkward in here.
Funny you should mention that. Next week, we're actually headed to Rosemary Beach, which is just past a couple, maybe 15 minutes past Destin, Florida. We're going to go hang out for a week. That should be fun, taking the dogs with us.
You're taking another vacation? That's interesting. Wow. Okay.
You just got done saying I haven't taken one in like 3 weeks.
For those of you that are looking for a career path, you can either do plastic surgery where you work day and night, and you're just working yourself to the bone, or you could be a CRNA and you could work 3 weeks a year. So, I feel like you can do whatever you like. There's some career options, but boom, boom, boom.
Hey, everybody's got choices, man. Everybody's got choices.
You're doing well.
No, we're excited. We're actually gonna pop in and see Mary's parents in New Orleans. That's my wife. Her family is still in New Orleans. That's where she's from. You can follow her at Your Trendy Therapist.
That's an early plug.
I know, man.
That was a good plug.
Yep. Thank you. It's seamless almost. No, we're going to hang out and see them for a little bit. Every time we go back to New Orleans, I got like 3 or 4 spots we have to eat. It's like the second we pull into town, we've got a couple, got to get the po' boy, got to get some good Italian food. It's good stuff.
Okay, I like it. And then Gilberto, what's new in your life? What should Austin know about Gilberto?
Well, something that I actually shared with you not too long ago, and I haven't had a chance to share with the rest of the team.
I'm like a vault, so I haven't told anybody.
Yeah. Earlier this summer, I submitted some tapes for an audition for a position within the podcast group of my professional society, the Society of Dermatology Physician Assistants. And I got news last week that they liked my audition tapes, and they asked me to join their team.
That's awesome.
Dude, congratulations.
Oh, whoa, wait a minute.
I'm glad that you still have time for us, just little lonely souls in Austin, Texas.
That's what I was
now that you. So the other question is, does Gilberto need the celebrity title, and we have to strip this and just make Travis like average anesthesia?
Dude, I've had.
That is a great name for you.
No.
That is a great average anesthesia. That should be your new hashtag.
God.
Who wants average anesthesia? Big me.
Come on down and get it. Oh man, I'm getting killed today. That's like my 4th time having chest pain in 3 episodes. This is terrible.
Congratulations. I mean, that's a huge honor because I know they take people from all over the country, and they only pick a couple people.
Yeah, they only selected 2 people to join the team. I think I'm joining a team of 2 others, so it's going to be a team of 4, is my understanding. I'm still trying to get all the details, but actually, I wanted to thank you for giving me the opportunity to do this, but and Donald for helping me put the clips together. I genuinely appreciate that. Thank you. I have it all. I owe it all to you guys.
That makes you a greater than 1%er. You're like a 0.1%er in this world now.
Are you even gonna have time for us little people anymore?
Yeah, absolutely.
We lifted him up, and then he's forgetting about it.
No.
Well,
this is it's actually just it's a voluntary position. So I think we only film episodes around the time of our annual conferences and stuff. So I don't think it's going to interfere with plastic surgery. I'm not going to let it.
Are they?
I'm sorry.
I said they're not going to make you do quotes, are they?
I'm going to bring it on.
Are you?
No.
Don't let average anesthesia talk to you like that.
Dude,
you're a celebrity, dude.
We are not starting that hashtag.
I feel like I'm creeping up to Joe Rogan status. Multiple podcasts.
You're on multiple things. You're just making things happen. I want to be like you when I grow up, dude. I'm just a lonely worker bee, dude. Well, let's do this. If you don't mind, let's get this show started. Gilberto's not off the hook, and just so you guys know, we're gonna split Fact or Fiction up among people, mostly Gilberto.
Oh, great.
Yeah.
That's what I'm talking about.
Yeah, and he already knows what's coming, so he better be ready. For those of you that listened to episode 27, you should. Gilberto avoided the question 16 times, so we'll see if there's any updates to that as well. So boom, boom, boom. If you don't know, pause this one, go to episode 27, then come back. This episode's actually started off really, really strong. There's some good golden nuggets here so far. So we're going to talk about injectables. Gilberto actually came up with this idea when we were flying to El Paso to visit my mom for her birthday. Big baller status. For those of you, again, that didn't listen to episode 27, big baller style to fly with Gilberto where everybody recognizes him. So that was kind of cool.
Exclusivity has its perks, John.
That's what you kept saying. That's what you kept saying. When you told the flight attendant, follow me, and she's like, oh, wow, you have 126,000 followers. And he goes, I ask everyone that I meet to follow me.
I think you're confusing me with you.
But talk to us a little bit. What's going on today? We're talking about some injectables. People know typically about the standard Botox, lip fillers. We've talked about jawline, but there's some other golden nuggets that we've never touched on.
Yeah, no, there's so many different areas where we can actually treat with Botox and filler and make a huge impact on a patient's, image and their self-confidence, their perspective on things. So I kind of wanted to put together a little episode where we can talk about some things that some people may not know about that are treatable with either Botox or fillers.
Where do you want to start us? Let's kick this off. Let's get the show going.
So one of the things that I know you like to do that you really enjoy doing, and it's one of the procedures that I really enjoy doing as well, I just don't do as often as you do, is a liquid rhinoplasty, where we actually use filler to recontour the shape of the nose. And so it's essentially kind of like, creating a new shape of the nose without having the patient go through any kind of surgical procedure.
I love this little hidden nugget because it's one that I feel like people forget about. I think nose is one of these that's a really big decision in people's lives to go undergo a rhinoplasty, and especially for a certain type of nasal reconstruction, right? This isn't going to affect people's airway passages. This isn't going to open up airways. This isn't going to treat a deviated septum, but people who just want the illusion of a sleeker, thinner nose. If you want to hide, from your profile, especially in this day of social media, Instagram, YouTube, Snapchat, TikTok. Did I miss any? LinkedIn, I guess. Facebook. Oh, I'm too young for Facebook, dude.
TikTok.
We're different ages here. But so, can you mail me a letter? But so, it's really cool because you can just smooth out the top of that nose and just enhance stuff. I think you got to be a little careful in terms of how much you can change from tip. I think you also got to that's an area you got to be careful in terms of intravascular injections. So being right on the periosteum or bone, depending on what part of the nose you're treating. But I love it. Thoughts you have?
No, I think you hit it right on the top of, you hit the nail on the head. You got to be really careful about, those little blood vessels that kind of run along the side of the nose, and make sure that, you're basically laying the product down on the bone itself. But yeah, there's so many different things you can do with a liquid rhinoplasty, from, kind of correcting a little dorsal nasal hump or bump to, something called a saddle deformity, where it creates, the nose kind of has this congenital kind of like little shape to it that makes it look like a saddle, which is where it gets its name. And you can just kind of fill these areas in to kind of make everything a little more even and more aesthetically pleasing.
The other thing I love for liquid rhinoplasties is just when people maybe have already had a rhinoplasty and they're either waiting to do a revision, or it's so minor that they really don't want to go under surgery again, and then doing that, because some of those little things you can smooth out, and people do great. The other great thing I love about injecting noses with fillers is I'll typically do a product like Voluma, which is supposed to last about 1.5 to 2 years. I think in the nose you really get pretty close to that 2 years, because there's not a lot of motion, there's not a lot of action there, and so in general the product tends to sit pretty well, unlike a lips where we're constantly talking, moving, eating, drinking, and the product gets kind of massaged out. That's not true with the nose, and so a treatment can actually last patients a long time.
I was going to ask about that, so as far as because when we do talk lips, it's like every month or two or whatnot, you're going back in for a new treatment.
Where are you getting your lips done that you're going in every month?
Come see me, Donald.
First off, natural. But
okay. But you're talking for a friend again.
Yeah. But the one question that I do have is when it comes to recovery versus a normal rhinoplasty versus an injectable, what are we looking at?
That's a great question, and that's the beauty of it. I mean, we have a lot of patients that will come in, do it on their lunch break, go back to work, and then they're looking good. I definitely wouldn't do it the day before a wedding or a photo shoot, because you can get a little bit swollen with the nose. A little swelling can linger for a couple days. Don't want to go do upside down yoga or something that's going to enhance that swelling. But other than a small bruise or a little swelling, people feel fine. They look good right away, and that's really one of the benefits of it. I do tell people who are looking for a more dramatic change, one, there's a limit to how much we can do with filler. Two, sometimes if people have a large deformity or defect that we're trying to correct, may need multiple sessions or more than one syringe, and so that's something we can talk about at the consult.
Yeah, no, I agree with that.
Do you do other products besides Voluma for the nose? What do you like to do? What's your go-to for some of that?
So I'll use a number of different Juvederm products. I'll be honest, I haven't used Voluma in the nose. I'd be interested to try it, but I usually use something that's maybe a little thinner, like a Juvederm Ultra or Ultra XC. I really like Restylane Refine for that area. I think it's got a lot of really great properties to it, where you get the fullness and the product kind of like a Voluma, but it's still kind of soft. It's not a very
sort of
firm
like our
product.
gummy bear implants.
Yeah,
it's a fullness without firmness.
Yeah, I like that.
That's incredible, but from an injectable standpoint.
So those are a couple of the ones that I more commonly use, but there's a number of different really great filler products out there. Some new ones coming out too.
And I think that's where, having a good provider that you trust can really help guide you a little bit, because it depends on the length of time that people want. Some people are like, hey, it's hard for me to come back. I want something that's going to last 2 years. I'll see you guys, in a couple of years. Other people are like, hey, look, I'm really nervous about it. I don't want to spend a ton of money. Let's start with something a little shorter acting, make sure I love it, and then go from there. Not 1 month short acting like Donald's getting for his lips, but, something that helps us a little bit.
Right.
Now he's got me thinking about my lips.
No, I mean, you got great lips. You're a good looking man, Donald. You're a good looking man. I mean, not Austin's most beautiful man, good looking, but good looking.
I'm getting there.
Okay. That's cool. I mean, average anesthesia is not going to let you take his spot. But what else about the nose should people know? Because a couple of things that I always tell people is that the tip is really hard. We can do some subtle tips, but that's where people get themselves into trouble thinking that they can do too much with a tip with filler.
Yeah, I think it's the tip is a bit of a challenge because most people kind of like that little everted kind of nasal tip that kind of comes up, and sometimes it's hard to get that with just filler alone. I think. I mean, that. What's your experience with it?
Yeah, I think trying to get an upturn with the nose is hard. I think the things that people tend to see and do really well with liquid rhinoplasties is from the profile, hiding that dorsal hump, smoothing that out. I definitely think you can give people the illusion of a thinner, sleeker nose.
Yeah.
I think you can, if people have some curvature or crooked nature to their nose, I think you can give the illusion of straightening that out. I think you can, enhance the overall radix or the apex, the nasal bridge, just to make that a little bit fit into the face a little smoother. So those are the areas that I tend to see. People do well with the liquid rhinoplasty.
Best results, yeah.
Have either of you guys have y'all used any threading procedures with the tip or with the bridge in the nose?
I have not done any threading for the nose, and I would be a little cautious about that.
Yeah, I personally haven't either.
I've seen a little bit on Instagram and around on social media. I didn't know what y'all's take on that was.
I'll tell you, I've been a little hesitant with the threading, and I'm not saying that it's good or bad. For those people that don't know, threading was on the market, and it was on the market about 10, 15 years ago, and then got taken off. They changed what the threadings actually used. They had used non-absorbable sutures previously. People had some problems with erosion and because it's basically like a barbed suture. If anyone's watched our tummy tucks and other things, it's that special suturing that holds and locks. So basically, you can use this to grab some of the tissue and just slowly bunch it up. So you can do some slight changes that's based on the strength of the suture itself. And the idea is that you're getting it, holding it, and then before it would erode or do anything through the skin, which was the problems in its predecessor, is that suture will dissolve over the next 6 months to a year. So I think there's some optimism there, but obviously when you've seen the bad side of some things, it's some caution too. That's my 2 cents.
No, I like it. That's why I'm here. I'm here to learn.
G?
I honestly don't have enough experience with threading. I do remember it from about 10, 15 years ago, and then it kind of just fell off the face of the earth. I didn't know why. I wasn't in cosmetics at the time. I would think 15 years ago, I was probably still doing family medicine.
15 years old?
If only.
Let's talk about some other things that people can do with injectables that people forget. One of the ones you brought up, just kind of starting to work maybe from the top down, so we don't skip around too much, is temples.
Yeah.
Temples are a phenomenal one that I feel like people forget about, especially when you're a little bit older or if you're very, very, very thin. Our temples can hollow out, and it just gives us a little bit of an overly thin, sometimes unhealthy appearance, and it's a really cool one that just adds a little bit of volume to the face. By adding some volume to the upper portion of the face, it can actually make our cheeks and lower third of the face look slimmer because of this whole perception. And again, the
everted triangle.
Yeah, the little plastic surgery magic where we add volume that actually makes you look thinner, which is super cool.
Yeah, I like that a lot. I think it's a great procedure. I've done Sculptra for temples before. That's great because it's kind of like a slower onset of action. You see like the fullness almost immediately, but then as the product kind of gets absorbed, you kind of lose a little bit. But over a series of treatments, you see this fullness kind of return as the Sculptra kind of takes its shape. But I've also done hyaluronic acid fillers in the temples.
Before we jump to this, do you want to let people know what Sculptra is? Because it's cool. Because it's in its own category outside of the hyaluronic acids that we most commonly use.
Yeah. So essentially, Sculptra is like a suture product that is mixed with saline. And essentially, what it does is when you inject it into the area, it promotes collagen formation and more fullness. And the body will naturally absorb the water, but the product is left behind, and that's what creates this process where we start to see the fullness over an extended period of time. Some people kind of get turned off by it because they see the effects of it immediately and they like that, but then as the saline gets absorbed by the body, they start to lose a little bit of it, and they think that the product didn't work. But in reality, it's actually doing a much better job of probably giving you more longevity than like a hyaluronic acid filler, which will wear off after about 6, 12 months, 18 months, depending on which product you're using.
That's what's really cool about the Sculptra is that, for people who, and it's the plus minus, right? Because
Right.
people who want something like, hey, I want my own collagen, because it's basically what it's doing is stimulating you to make your own collagen
Right.
versus a hyaluronic acid, which are still extremely safe, and very good products. But some people like that, hey, I'm stimulating my own collagen. Some people are like, I just want results right now. I don't want to wait for anything.
Yeah.
So,
Yeah.
and I think it's just something that we have to talk to patients about, what
Right.
they're trying to achieve.
Is that collagen that's generated, is that permanent collagen, or is that something that the body will fall back into a routine of not producing collagen at that spot?
It's a little bit of both, unfortunately, because remember, you always have constant collagen turnover, and unfortunately, as we age, we lose collagens, and so the idea is that people typically get 1.5 to 2.5 years is a typical result with the Sculptra. Also got to remember, too, because it's stimulating your body to make collagen, and I'd love to hear your experience in this. I've seen people who are really great responders and people who don't respond quite as well. And that's the only frustrating thing for me sometimes is it's not quite as predictable. A syringe of Voluma or a syringe of Juvederm is going to be 1 cc of Juvederm or Voluma. Where with Sculptra, it can be a little different depending on each person.
Yeah, or it may require multiple treatments versus one syringe of filler like a Voluma or something like that, where you're going to see the results right then and there. With Sculptra, like I alluded to earlier, it's something that takes place over time. Like the results you're going to get, they're going to take place over like 4 to 6 months. So
No, I agree. So kind of know what you want, but the nice thing is it's slow onset, so people don't see a drastic difference, and then that lasts over a period of time. So good question, Donald. Thank you. Good question. Average Anesthesia has not asked any good
Yeah,
questions.
he's just sitting over there. I don't know what's wrong with him.
Another great one that we talked about is the brow lift. We've talked about this a little bit with Botox, but sometimes people don't really have any lines they want to treat, but you just want to get that brow up just a little bit and improve that overall shape. I think that's a great golden nugget for Botox, because some people are trying to use it to open their eyes rather than to get rid of wrinkles.
I do a lot of the lateral brow lift with a little Botox there, and like you said, it just kind of relaxes the muscle, opens up the eye a little bit, makes people look a little bit more refreshed and youthful, and they love it. It lasts with Botox, about 3 to 4 months on average, but it's such an easy procedure, and the results are phenomenal.
One of the cool things we were talking about recently in terms of brow lift is even doing a little filler out at the lateral portion of the brow, just to kind of kick that little lateral brow up just a little bit. And again, that's another neat one where a little bit of product goes a long way.
Yeah. I remember you told me about that last week when we were traveling, how you used a little bit of filler there. I got to say, I personally have not yet tried filler in the lateral brow, but I'd be interested to try it.
Cool. Maybe Average Anesthesia will take a little filler in his brows, give him a little opening.
I don't know, man.
Increase that shape,
I never got my Botox. That's something we need to talk about.
Why can't we do that? Can we set up a day? We do a little video.
Let's do it.
Clip it into one of these. Do a little Average Anesthesia Botox.
We got to do the shopping one.
We
do Botox one.
We do. I did
Body
do
by M-Sculpt?
a half M-Sculpt. Little
do we want to bring that up?
Wasn't that the
We
one
can
where
talk that.
Mary destroyed you? Or
She
no?
did.
Crush is the word.
Okay, she did better than I did with the M-Sculpt. But I will say, I could tell a difference, and I don't know if this is just totally placebo, but I feel like I could tell a difference in my abs from the 10 minutes I spent on M-Sculpt.
You know what's interesting? Since you never wear a shirt on Instagram, I could see the difference. I was just like,
damn. Whoa, that got a double tap.
Oh, man. I'm getting murdered on this episode.
I read something once where I guess when they were first creating the whole like button, they wanted to call it the awesome button, and then that got thrown out by was it Zuckerberg, and then ended up being just the like button. And so that was kind of interesting how stuff happens, but kind of cool. Let's keep marching down. And so, what about a little under eye filler? I feel like we haven't talked about that. That's another
one of my favorite procedures. It's just so much fun to like see the drastic change that you can make in somebody's appearance just by putting a little bit of filler right in that under eye tear trough area.
What's your filler of choice for that area?
For me, my filler of choice is Restylane L, just plain Restylane. I think it's such a great product. It's got a lot of, it gives you the volume that you need, but it's also rather thin. So, it doesn't make the under eye look overfilled. It just makes it look really, really natural. Plus, if for whatever reason, someone doesn't like it, it's super easy to just dissolve that product and just kind of start from scratch.
That's cool. What's your typical age range on patients getting that under eye filler?
It varies for me.
Really?
I mean, because there's so many different variables. Like some people come in because they are a little older and they want that more youthful look. But I mean, it's also kind of like for some people, it's kind of like an ethnic thing where they just have a little bit of a darker under eye kind of situation going on. And if you can put a little bit of filler there, you can sometimes camouflage that a little bit because you're separating the tissue from some of those blood vessels that create some of that discoloration. Sure. So you're putting a little bit of space there in between the tissue and the blood vessels. And so, I see patients from, all different age groups, but I think probably the youngest patient I've treated for under eye was maybe like 28, 29.
Wow.
Is that to fight the bags under the eyes?
It is. And sometimes people just have it congenitally, because I've seen people where their mom has it, the daughter has it, the son has it. And so it's, there's a fascial wall that holds those bags back, and they weaken as we age. But some people, I think, just have a weak fascial wall to begin with that leads to some of that herniation. But basically what you're seeing is the fat pads, which are different than the other fat pads like we get in our belly and other stuff. These tend to be pretty stable in terms of size, but the wall weakens and softens. So what you can do is surgically either take them out or you can camouflage them. And what you're trying to do is hide that peak, valley, and then peak, which shows off those bags, gives those dark circles, and try and just smooth and camouflage.
Yeah.
You guys are blowing my mind today.
Yeah, I didn't know about the brow lift. I didn't know that you could do an injectable to lift the brow. I thought that was always surgery.
You want to lift your brows and get your lips done for over a month?
No, but I'll tell you what. I'm thinking about the eye stuff.
Yeah.
The under eye stuff. Because I got a little bit of bag action.
Well,
I wear the glasses to hide it.
You've been a hardworking man, so
I am, editing stuff. And
I don't know about you, Dr. Franco, but I like to use this technique where we use a little cannula where I'll make like a little insertion point out here, like on the malar cheek, and then I'll just kind of guide the cannula underneath the eye, and it minimizes bruising. It's a little more comfortable for the patient, in my opinion, and the result is, in my opinion, probably even better than just going straight in with a needle.
I haven't, but it's something that we've talked about in our office, is incorporating the cannulas for under eye fillers. So something I definitely want to do, and we'll do soon.
Let me know. I'd be happy to come by the office and work with you on that.
You got to teach him.
I would love it. I would love one most beautiful man to come in and help us do a little cannula stuff.
I'll let you guys practice on me.
Let's do it.
Practice on him first, and then come to me.
We'll bring celebrity in, and we'll go from average anesthesia to celebrity anesthesia. Little Botox, little under eye filler. Boom, boom, boom. You're welcome. Well, let's just to keep stuff moving a little bit. Other Botox tricks that we do, and we talked about this. Another kind of sleeper is something called the masseter muscle. So sometimes people get it because they're always like biting down, and it helps with headaches and other things. Some people it's just to slim that face a little bit.
I get that a lot, especially with the advent of social media and photos and wish photos and such. I have a lot of patients come in and ask me to get some Botox done in their masseters just so they can kind of get a little bit of a slimmer, elongated face for their social media photos.
I mean, we can't all have the chisel jaw that celebrity anesthesia has, but for those of us that don't, there's ways to get there.
Yeah, absolutely.
Damn, that's a good looking man.
I did have a question. Do you guys do anything with the neck and Botox?
Yeah. I mean, that's another great one. If people just have a little bit of platysma bands, that's a good one to kind of a cheater before people need a neck lift or something to that aspect. So that's a good one just to soften and get the neck back up a little bit.
Yeah, there's a term that's kind of become pretty common vernacular is tech neck, where we start to see, these like horizontal lines across our neck because we're constantly looking down at our devices and stuff. And that's something that a lot of people are coming in to get treated just to kind of soften those lines up because they're kind of like the lines in your forehead or in your brow. If you move those muscles often enough, you're going to get those lines kind of set in. So Botox kind of helps soften that up amongst other things like diluted filler too.
Mm-hmm. Are you using a diluted Botox when you're doing the neck like that, or are you just using a regular concentration?
I usually just use a regular concentration. I just feel like if you dilute it too much, then you have the potential for the Botox to kind of spread, and you may get it in areas where you don't necessarily want it, and that might make it uncomfortable for the patient or just kind of different sensation.
Sure.
I think you do have to be cautious about the amount. I think the level at which, being more superficial in the neck, I think is super important. Yeah. You got to know what you're doing. You can't be super deep or else people can have problems. So no question, like with the muscle bands, I'll grab them, lift them up in air, and then inject them with the neck. Same thing. Make sure you pinch the skin, get it up. And,
exactly.
So there's definitely some safety things to your point to make sure that we're in a good spot for that.
Yeah.
You touched about doing a little bit of dilute filler for the neck. That's kind of a hot topic.
Yeah, that's pretty popular too. I personally don't do it, but I have colleagues that do that I've seen, and it's pretty impressive stuff where they dilute like Radiesse or another HA filler, and they'll just kind of do like these little micro injections along that horizontal line and just kind of really smooth it out. It's really impressive the results that we end up getting out of that. But I'm really interested in finding a good candidate to do that on.
Cool. No, I think the neck with this day of Zoom and webinars and everything else has just become more and more and more and more popular. Can we talk about a few little like really cool, interesting stuff? Like I did one the other day, and you had brought it up. Earlobes.
Yeah.
Earlobes is another one because some of us probably don't deal with this as much, but if the ear opening gets a little big and the ear's a little thin, the ear rings won't sit perfectly, and so fill in the earlobes and kind of holding that volume in lets things sit a little bit better. Just kind of doesn't give you some floppy earlobes. So that was a great little nugget by you.
I love that one, especially for women that have been wearing really heavy earrings most of their life. That just kind of pulls down on the ear, and that gravity is just kind of stretching that earlobe out. You put a little bit of HA filler in there, and you can just kind of reshape it and give it a little bit of volume, and you've got a youthful looking earlobe again, and not only that, but it's going to help support that heavy earring again and make it a little easier for that patient.
That's cool.
One that I've heard about but I've never done, and I was wondering if you've done it, is I've heard about people getting their feet injected because they feel like their heels are uncomfortable, and they'll get like the pads of their feet injected. Have you ever done that?
I haven't. No. There was a time when I would do like Botox for excessive sweating or hyperhidrosis, like under the arms and on the hands, and it can be done on the feet also. But I've just never done it. It just seems like it'd be such a painful, procedure. Patients are willing to do it because in this example, they sweat excessively on their feet. They're gonna see some drastic improvement from having Botox done on their feet, but. And so they're willing to do it, but I haven't done it for either that or what you're mentioning.
Okay, just a man with a foot fetish. I thought if there was someone who would have done it, it would have been you. So no, but I'm glad you've cured the world of sweaty feet with Botox too.
No, I haven't.
That's great. I appreciate that. Thank you.
That's what I'm saying.
Thank you.
What about
the gyms in Austin? Thank you.
I do have a question about one other spot for filler. Back of the hands.
Oh yeah, that's a good one.
That's become an increasingly popular one because back of the hands shows your age.
Yeah.
No question, it shows your age. So
back of the hands and neck.
Neck. Mm-hmm.
I like how Dr. Franco looked at his hand.
I got some great looking hands. I could have been
Look
like
at
a hand
Could
model.
have been a hand model. Oh my god!
I don't know if it's possible for us to zoom.
QVC, where you
I don't know if
at?
it's possible for us to zoom in on that, but that looks good. For those of you just listening, these are some great looking hands. They're soft, they're
baby
smooth.
hands right
yeah, no, but strong. Very strong.
Not a day of working at the
but very strong. These were farmhands. Gilbert got a chance to see the orchard that I grew up, picking pecans with these bare hands, and I feel like that helped my fine motor movements, just finesse.
Picking up tiny little pecans.
Yeah, just one after another.
my-
Millions over time. Millions.
Oh my god.
What
Deep in here.
what other cool little Botox or filler nuggets would you like to share with us?
Décolleté. I think that's a big area. I get a lot of requests for that too. That's the area on the chest that gets exposed. Mostly women coming in asking for little Botox on the chest
I didn't
because
try this.
because the chest is exposed in a lot of women's blouses. They're either like kind of low cut or V cut, so it gets a lot of sun exposure. And as we know, sun is what kind of triggers a lot of premature aging, and so women will start to see these vertical lines kind of form on the chest there. And so if we do a little bit of Botox on the chest, you can relax those lines, and they really love it. They think it's a great result.
So if you're running around downtown Austin shirtless on Instagram, would you suggest that?
I mean, it depends on whether you get a lot of sun on your chest.
Huh, interesting.
I mean, if you're running around shirtless, I would imagine so.
Man, I'm going to need like 9 things done when I go to the office.
Well, we can't have average anesthesia walking around. We got to be nothing but the best.
That's right.
I think it's kind of cool because, and this is where I think having a really good provider is going to help in terms of this, because there's a lot of really cool things you can do, but also things it's a waste of money.
Yeah.
There's products that shouldn't be injected in certain areas, and then different safety stuff about what can be done safely or not. We've talked about a few of these in terms of, the level at which you inject around the neck. I think, especially for the master, knowing, where the right space is, and also realistic about what change that's going to be. I think the under eyes, the nose, those are both great ones. But again, using cannulas, being on bone, there's definitely a few nuggets that really make this safe for patients.
Yeah, absolutely. I think it's just, and like you said, it's a matter of going to your provider, asking questions, making sure that your provider is comfortable doing these procedures, because a lot of the stuff we're talking about, they're advanced injection procedures. They're not for someone who's just kind of starting out doing injectables. You want to go to someone who's been doing it for a while, that knows their way around the anatomy of the body, the face, the neck, the chest, so that you have the best outcome possible. Because as Travis has said many times before, what we're here for is to educate the patient and make sure that they stay safe.
Yeah, I was also wanting to point out that I like the fact that there are so many options other than going under the knife for these little areas around the body. It's like, I think a lot of the times people will think that, hey, if I want my nose changed in any way, I got to go under the knife. And as we've explained today, it's not the only option.
It's not the only option, but we've seen the flip side too, where people will just spend so much money on fillers, Botox, and never get the result that they're hoping for. So I think this is where having somebody you trust that can guide you and say, hey, look, this is what we can get with Botox and fillers. If you want more than that's facelift. There's even patients who come in for a facelift or whatever, and I'm like, hey, what you're looking for, I can't do. And so I think no matter what the procedure is, being very clear about what we can and can't do.
Yeah, knowing your limitations is huge.
100%.
Celebrity, what about in terms of anesthesia? I think we've talked about this on previous injectable episodes, but there's a couple things that we do. We do numbing cream for most people. Pronox has been something. We honestly took it out of our system during this whole COVID. There's now some specialty filters that you can put on it that are, of course, on back order. But as soon as we can get those in our hands, we'll start offering that again. So there's some options. But any thoughts about anesthesia during these injectable procedures?
I mean, you guys use such small needles, and then with the local anesthetic cream that you guys put on for patients prior to having any injections, honestly, it's not bad. I've had some of the local cream on my head before. I had a couple PRP injections in my scalp, and I couldn't feel it at all.
Yeah, I think some of the new numbing creams, I think the Pronox, I think some of the nitrous oxide gas stuff, I think some of the things have made it a lot better. Most of the products themselves come mixed with lidocaine in it. If they don't, we have the ability to add it.
Yeah. And one thing that I think we haven't really talked about is ice. I mean, ice is a great numbing agent. We use that a lot, and that's really inexpensive.
Agree. And to your point about ice and swelling and bruising stuff, a couple take homes just so people don't forget if they didn't listen to our other 18 episodes about injectables is, one, make sure the day before a wedding, a photo shoot, your first date, whatever, it's not the time to come in and get injectables or try something exotic. So, because with Botox, it could take up to 2 weeks to really see the full effect. And honestly, people look better at 2 months than they do 2 weeks. If you have some deep lines, it takes time for all of that to smooth out.
Yeah.
If you're getting fillers, last thing you want is to be a little swollen. Maybe you get a little bruise. And I have people come in all the time and say, oh, well, you never bruised me. I was like, well, you've just jinxed us both, and I guarantee you're going to get a bruise now. But don't do that to yourself the day before a wedding, the day before this, especially when you do something new. Give yourself time.
Yeah.
And that way, if you get a bruise, you get something, do a little arnica, and you'll be good. So plan ahead. Also, with a lot of providers and COVID and everything else, I know in our office, we've limited the flow through the office. So sometimes a little harder to get into your favorite injector. So being a little careful that you plan ahead of time and you're not left out.
Yeah. Yeah.
Other take-home points for people to think about ahead of time?
I think we talked about a lot of different things. Again, I can't emphasize this enough. It's really a matter of like setting expectations with your patient, talking to the patient. What are their goals? What is it that they're trying to achieve? And really, I think if you can develop a good rapport with them, you're going to have a patient for life.
Donald, any take-home messages or thoughts, questions, concerns for your friend with the 1 month lip fillers?
No, that's like I said before. My big thing is I just want people to know that there are many different options that they have other than just going under the knife, and having these proper conversations with your injector and your provider to explore all your options before you make that decision.
Average anesthesia, anything?
No, I think you guys hit the nail on the head and covered kind of everything with injectables. Really cool. Learned about some new techniques today that I did not know about, and some of the things that you can do, like you said, with a liquid rhinoplasty, with doing a brow lift, with a little bit of Botox. That's cool stuff, and maybe great candidates for that are people that are may need a brow lift in a couple of years, a surgical brow lift, but this may buy them a little bit extra time. And that's like y'all were saying, talk to your provider, get a game plan together, and have those conversations where you can actually hash out a realistic expectation.
I sure hope Mary's not listening to this episode, or it's going to cost you a lot of money.
Oh, I know, man. Story of my life.
Can we do a little fact or fiction?
Let's do it.
I don't know.
And there's really just one big question. I just want to clarify this for all the ladies in America. Fact or fiction? Gilberto is back on the market.
Uh-oh.
Because I feel like this is a big one.
Uh-oh.
That's fact.
Oh,
wow!
You heard it here, folks.
Oh, you gotta pop the collar when you. That's a fact.
Oh yeah. Yeah, Donald's talking big over there. He raised his seat.
Yeah.
I had to. Yeah, you guys made me look short on this.
But I guess the question's always like, what do you do? So do you take a little time to get yourself, back in a little hiatus, or do you jump right back on the wagon? Because every time we're together, I feel like people are just throwing themselves at you. We were on the plane and somebody's like, I recognize you. And it's just, I feel like it has to be hard being Austin's most beautiful man.
So I don't even know how to answer that.
I hope people watch this episode so that they can see you blush.
Oh yeah.
I think I'm as red as my jacket, if not more. Honestly, I don't know how to answer. It's something that I think I'm going to ease into.
Okay.
Yeah.
Okay.
Yeah.
Because a lady friend of yours recently compared you to a piranha, didn't she, or a bull or something like this? Is that fact or fiction?
I think the quote is wrong, and
enlighten us.
I think it was more along the lines of a one-eyed, three-legged pussycat.
What?
I don't even understand why they would say that about you, but this is a family show, so we won't go into this. What's on that note, Gilberto, to let you off the hook? What's a little behind the bovie nugget that you would share for all of our fans and your fans out there that about injectables that they should know?
I just think that there's so many different innovative ways that injectables and Botox can be used, and we're just coming up with new things, as time progresses. Not just new techniques, but new products, that are coming to market, that are going to be longer lasting Botox or shorter lasting Botox for someone who just needs something for like an event. It's going to have quick onset, but it'll also wear off quickly. So it's an expanding world in aesthetics and injectables, and I'm really excited to see what the future holds.
Yeah, you talked about a few products coming out, and we're not going to let the cat out of the bag yet. So I think, but some new stuff coming out soon that I think will make some nice differences. I think sometimes too, people come in all the time like, oh, I want lip fillers, I want this. Sometimes just. And I try to get people to express what bothers you, because sometimes we can help guide them with some of these other tricks that they may not even know about, and that would be more helpful if we know what really concerns them. So I think that's a good point. What about quote of the day? Can we get a quote of the day? I feel like we've struggled a little bit recently for those of you that have been listening.
I feel like I should hand the reins over to
no. I'm going to give you a shot of redemption right here.
Average Anesthesia forgot that he does the quote of the day, so we had to audible Average Anesthesia.
Do I need to step up in one?
Oh my God!
So Anesthesia, are we going to get a quote of the day?
I was going to let Gilberto redeem himself. Right. Last two were not up to his normal level.
Wow. Okay.
All right. Well, let's let me see if I can redeem myself.
Here we go.
How about this is from Babe Ruth.
Ooh. Okay.
Babe Ruth said, "Never let the fear of striking out keep you from playing the game."
I like that.
I like
that one.
Yeah, I like
Coming
that.
back strong.
Is that redemption?
That is
redemption.
Yeah. No,
Heavy.
It's interesting. I think we were talking on the plane when we were flying that I've been listening to Phil Knight's book. Him talking about how he created Nike and so forth. He struck out a lot, and so it's amazing. But you got to get back up.
Yeah,
got to just get back up. I mean, just because you got nicknamed Average Anesthesia one day doesn't mean you can't earn back celebrity. So we'll see. Got to just work hard for it. Donald, thoughts about striking out?
Don't do it.
Tuesday and Friday?
Don't do it.
Tuesday and Friday. What? I don't know.
Celebrity?
I think that couldn't be more timely for Gilberto. Back on the market.
That's true.
No fear striking out, baby.
Yeah. All right.
Full steam ahead.
I don't think Gilberto struck out, but it's we'll agree to disagree. So who knows? Well, I want to thank everybody for coming on. Producer Donald, I'm glad that you worked us into your schedule. Gilberto, thanks for taking the lead on this cast.
This one was fun. Thank you.
The fans wanted it. They said they wanted more G. We got it. Average Anesthesia got a new nickname, which I couldn't be more happy about. So boom, boom, boom. I love it. Guys, don't forget, you can follow us on Instagram at Plastic Surgery Untold. You can see us on YouTube. Austin Plastic Surgeon, or you can download us on iTunes or wherever you get your favorite podcasts. Greatest podcast in the world, as voted by us, Plastic Surgery Untold. Thank you, guys. Bye.
Before we go.
Wait. We didn't
But there's
That's
more.
how we close every day, but it's not.
Yeah, I gotta break in. What's on the next episode?
Oh, I don't know yet. I don't know. I usually write the scripts about 20 minutes before the show. But if you want to, and today we finished, so I don't know. Do the people want to hit us up on Instagram? Maybe DM us. Maybe give us some shouts of what they want to do. Why? Do you have a topic?
Well, no, actually, I was following the notes in the for today's script.
Yeah.
We were supposed to plug the next episode.
Oh, yeah, but I don't have one.
See, that's
So maybe we can reach out to our fans and ask them to give us some ideas, some suggestions.
You can DM us. Let's go through our Instagram handle. So, Tall Gamer.
Tall Gamer, TALLGAMER.
Oh, people don't know how to spell tall.
I'm just saying, you know what? I'm not insulting our audience.
That was a tough one. Okay, that was a tough handle. I'm glad you clarified that. G?
Austin Aesthetic PA.
Boom. Okay. And celebrity?
Celebrity Anesthesia.
Okay. You don't want to spell that one out?
I figured.
Hey.
I'm going to give the listeners the benefit of the doubt.
And then Austin Plastic Surgeon. So can I close it out or anything else, Donald?
Sure, run it.
Now it's my show. Okay.
I'll give it back.
Thank you, Donald, for letting me take it back. Download us, greatest podcast as voted by us. Maybe not Donald, but by everyone else on the crew. Download us on iHeart, wherever you get your favorite podcast. For reals, we'll see you guys. Thanks for joining us. Bye.
See you guys.
Thanks, guys.
Peace.